My name is Daryl Stephenson, and I'm the ergonomist at OHCOW in Hamilton. A little bit about my background. Before working at OHCOW, I was a CFL player for 6 years. I had a history. I had 2 concussions early on in my career. I got through it and managed to play for 6 years and without any more problems. Following playing in the CFL, pretty much the month after I retired, I got into a PhD at Western Ontario, where I studied concussions with CFL players by interviewing them and finding out reasons for underreporting. And I was also involved with a lot of other research around concussions at Western. Okay, so my outline today, I will say you guys will get all this information on a PDF afterwards. So there is a lot of information. I didn't want to leave anything out. There's a lot of lists that come around with concussions and symptoms, and I just didn't want to leave anything out. I have noticed, looking around the internet and just trying to find general information that a worker would try to find, it is very much the fact that each source of information you'll come across will have about 25% of everything that you really need to know about concussions. So I really wanted to bring everything together. So I'm going to be talking a little bit about what concussions are, some of the effects of concussions, some of the workplace factors that can lead to concussions, what can be done to prevent them, and talk about concussion recovery and returning to work. And I'm going to tie this in with mental health as well. So what is a concussion? Well, the 5th consensus statement on a concussion in sport, held in Berlin, describes a concussion as a traumatic brain injury induced by biomechanical forces, and it can result in a variety of symptoms depending on the individual, so it's very individualistic. So there's a lot of ambiguity in definition of concussions and post-concussion symptoms. There's a lot of variety of terms used. So you'll see throughout even my presentation and any kind of information you try to look up, a lot of times they'll talk about mild head injury, mild traumatic brain injury, and cerebral concussion. There's also a lot of slang expressions used, and I notice this a lot in the sporting environment, especially talking with CFL players. Things like being dinged or having your bell rung or seeing stars. This is very much the language that gets used around concussions. So as this picture demonstrates here, depending on how you're looking at it, how you're trying to interpret it, what symptoms you're looking at, concussions can show up in a lot of different ways. So just a nice little visual. It's cognition, it's fatigue, it's the neck pain. So a lot of different symptoms can show up, and you can look at it a lot of different ways. There are some defining features of concussions. It's maybe caused by either direct blow to the head, face, neck, or else anywhere in the body. And this is something that's very misunderstood, especially even in sports. They're coming around to it now, but definitely in the workplace. If you were driving a car, for instance, and you got in an accident and you never hit your head, you could still have that whiplash effect and have those forces transmitted to your head. And so a person that never hit their head, they might not be searching for the fact that they have a concussion. Maybe they don't have a headache right after. Maybe they just have overall lack of energy throughout their work week. And they got in that car accident, but they don't think that could have been a concussion because they never hit their head and they don't show the big signs and symptoms that they're used to thinking about with head injury. Okay, so it does not require a loss of consciousness. And even with some of the CFL players I talked about, they said, I wasn't knocked out, so I don't think I had a concussion. But it's very much that doesn't need to happen. Okay, it typically results in a rapid onset of short-lived impairment and neurological function that resolves spontaneously. And in some cases, the signs and symptoms are delayed and will evolve over minutes to hours. And that was actually one of the cases that I had personally. I played in a game. I don't remember anything ever getting hit. We never saw me get hit really hard on film. But the next day I had headache symptoms. So they said, you should go on the protocol and be safe just in case. Okay, there's a large list of potential consequences, which I won't read them all, but I'll go over some of the basics, is that your cognition can get affected, your memory, judgment, and communication. Sometimes it's movement ability, strength, coordination, balance, or sensory, or even your social relationships, struggling with that. So here's what I was talking about. Many lists exist, and they keep getting updated as we go along. But mainly, the overall is just anything that's not normal that you're dealing with. Just even the symptom of feeling off is one of the symptoms. So it's very hard to picture what that would feel like. It's a very confusing task to go through and try to identify all the symptoms that you do have, especially when you're going through a concussion. So there are some more common features. Because of duration, symptoms, diagnostic testing, and treatment in each case is so varied, concussions can be very complex and very costly to treat. And it's very hard to predict the end result from the initial impact of the event. Okay, so even if a hit doesn't look like it was very hard, or an accident wasn't very extreme, or somebody just fell lightly at work, it could still lead to these potential detrimental consequences because it's very individualistic and hard to predict. So the concussion recovery typically resolves with days to months, but sometimes it can last for over a year. And every time I talk about concussions, I have people come up to me after and say, I know somebody that's been dealing with this for over a year, for over 2 years, and it's very much an ongoing battle with the concussion recovery at times. Depending on the severity of the trauma, it can be very prolonged, and this is due to microscopic physiological changes that occur post-concussion, and they can have delayed secondary injury implications, and that's very important. These early physiological symptoms, such as headaches, can turn into psychopathological issues, such as anxiety, hypersensitivity, and depression. So the longer people go on with concussion symptoms, the more chance they have to have these mental health effects. So post-concussion symptom, the reasons for persistence. So though a consensus has not been reached on the cause of these, why it persists, why you have long-term symptoms, it's most likely that it's a factor of biological, physiological, psychological, and social elements that all play a role in the symptom persistence. And suffering from these symptoms for an extended period of time may delay an individual's ability to return to work. It may adversely affect one's quality of life and their developmental trajectory, and result in additional social and economic costs. So some factors that they've noticed through research that may contribute to persistent post-concussion symptoms are medication-induced fatigue, so if people are on medications, if they have vertigo, if they have deteriorated sleep hygiene, if they are using alcohol or other drugs, or if they have depression alongside with their concussion. Okay, and up to 80% of people who experience moderate to severe concussion symptoms may develop post-concussion symptom. And this post-concussion symptom is just prolonged concussion symptoms, but many of them. So a cluster of symptoms, they might have trouble in many different areas with their symptoms. Okay, so these can lead to anxiety, again, depression, fatigue. Okay, and it's very hard for employers and insurers because you can have a concussion and you can go get a CT scan, an MRI, and everything, and you look fine on the test. Nothing is showing that you have a problem. But you do know that you have a problem personally. You know that you feel off or you feel fatigued. Something is wrong, but it's very hard to prove it. It's very much an invisible injury, and that can lead to a lot more stress for the person who's trying to work, and if the culture is try to suck up the injury and work through it, it's very hard for people to show what they're truly feeling inside. Okay, it impacts your memory, your mood, your function, but again, it's very difficult to prove with any pretests. And one thing I noticed definitely in sports, and I hear this a lot from younger athletes, even athletes as young as 10 years old, and definitely would be in workers, you can game these pretests. So if you take these concussion tests where it shows your baseline, they'll underscore purposely so that if they ever do have a concussion, then they would show as normal. So they're already planning to kind of hide these symptoms. It's really hard, again, for them to see how you're feeling. And it's very hard to identify your own symptoms. So if I were to ask, and we did this, I went into classrooms at Western University and I asked, what does it feel like what does being in a fog feel like to you? Because that is one of the symptoms that you're supposed to check for, feeling like you're in a fog. And we had very different responses throughout the classrooms based on that question. So even just identifying your own symptoms, feeling how you're feeling, it's very hard as well. Okay? And then also symptoms can return. That's why there's a lot of times there's a graded process when coming back from the recovery, and you start slowly, start back to work, maybe have reduced hours, but symptoms can return, and they can return spontaneously just by increasing your heart rate or activity level. So, if somebody might feel like they're cleared and come back to work, and all of a sudden these symptoms show up, and then they got to go through that process of, again, how do I prove that this is actually happening? So there are mental health issues after concussions. So 1 in 5 may experience mental health symptoms up to 6 months after mild traumatic brain injury. So in a recent study, 3 months after injury, 20% of MTBI patients reported mental health symptoms compared to 8.7% of orthopedic trauma patients. Okay, so this is showing that, again, these concussion injuries are much more linked to mental health problems than other injuries. Okay, 18 to 37% of people with persistent symptoms of a concussion develop depression in the first year after injury, and 1 to 2 years after the injury, this rate can double up to 61%. Okay, so this really paints the picture that the longer people are going on with these symptoms, the more chance that they're going to have these secondary symptoms such as depression. Okay, you can have mood swings, irritability, feel like you're on an emotional roller coaster, have anxiety or panic attacks. There's social situations can become very difficult for people with concussions, and they lack a lack of social activity leads to negative emotions as well. So a lot of times people with concussions or any kind of brain injury get isolated. A lot of times they're off work, they have to stay home, and again, that lack of social activity actually really affects them negatively. Okay, you can have low self-esteem, you can have PTSD about the event itself, which leads to more problems as well. So some general ideas when resolving mental health symptoms. You want immediate follow-up care right after the head injury. It's very crucial, as fast as possible, to get the appropriate care that you need. A lot of times it's about educating and reassuring the patient that they'll be okay and what to do and what information that they need. A multidisciplinary care team is the best way to approach it. You'll have a doctor that could be helping you with some of the physical symptoms, but you may need a psychologist to help you with some of the mental health symptoms, or a social worker. Okay, so getting that additional support that is required is very important, and it's very important to go to a qualified doctor or somebody that can help set you up on a good plan and path and not try to get through this on your own. There are some secondary implications with concussions. So a big one in the media today, especially in sports, is chronic traumatic encephalopathy. I can never say that. It's a neurodegenerative condition known as CTE, and it is thought to result from repetitive blows to the head, which accumulate over time and impacts concussion-like events. And it can show up many years later and cause many complications for day-to-day life. So this is kind of a hidden problem with concussions that's very much revealing itself today. And while it was originally seen in boxers, it's come out now in hockey players and football players and professional wrestlers. They noticed that in a study in 2005 with NFL players, retired NFL players, they had earlier onsets of Alzheimer's disease. Players with 3 or more concussions were 5 times as likely to report mild cognitive impairment. There's a 3-fold chance of memory problems as compared to players who retired without any previous history of concussions. And they had neuroimaging abnormalities and differences in brain metabolism disproportionate to their age group. Okay, there are also other future implications future problems that can arise. Alzheimer's like dementia, Parkinsonism, and ALS are known to be linked to concussions. And this is one that's very important, and I think it's very important to teach and educate about second impact syndrome, because this is one of the ones that actually prevents a lot of sport and CFL players and athletes from going back in when they know this. And this is something that I don't see on a lot of the information websites. And this is when you have a first concussion, your brain is now susceptible to a second one at a more alarming rate. So it's very dangerous to go back in, to go back to work, to do anything when you have a concussion. That second one has actually caused deaths in sports, and it definitely can lead to a lot worse symptoms. So when players know I have a concussion, and if I go back in, it can be exponentially worse, that's where they'll draw a line sometimes. Okay. So that's a very important fact, and I think workers need to know if I'm trying to hide this concussion or if I'm going to try and work through this, it could be very, very dangerous if I get a second one. So in Ontario workers, 7.3% of all traumatic brain injuries are work-related. There was 644 claims requiring time off in Ontario in 2012, up from 790 in 1996, so it's definitely an increase. A lot of this could be also attributed to the awareness of concussions due to sports and the media. So people are becoming more aware and knowing what to see, the signs and symptoms. And according to the Public Health Agency of Canada, traumatic brain injuries will be the most prevalent neurological condition by 2031. Okay, some more information. In 2013 Ontario, 80% of traumatic brain injuries filed to the Workplace Safety and Insurance Board were for concussions versus 50% in 2010. Okay, and statistics reveal that the time loss for work-related concussions is increased by 371% in Ontario from 2004 to 2017, or 13, sorry. Okay, 65% of occupational concussions were experienced by males. However, when I compare this to sport data, females in similar sports, that, like soccer, so something or anything where females are playing the same sports as males, it actually is shown that females do report more concussions than males. So I don't think you should be looking for too much of a discrepancy in the workplace. Okay. Overall, with concussions, depending on the population, the most likely event to cause a concussion would be a vehicle accident, a fall, or sports or recreational activities and assaults. Okay. In the workplace, in Canada, the highest rates of workplace concussions are in the industries of transportation, storage, government and primary industries such as forestry, mining, and fishing. And in the workplace, the most common concussion causes of concussions, again, slips, trips, and falls are very big. Being struck by or against an object, such as a falling box, motor vehicle collisions, and in a lot of cases, students, customers, or patients or coworkers might strike an employee. Okay, and that happens in schools with teachers, correctional officers, and jobs like that. Okay, but it very much varies by industry. Okay, so I won't go through all these tips, but there's very many tips online, and these are things that I did find in abundance when looking for information. So things like removing tripping hazards, keeping the shelves, the storage, when you're storing things, keep them not above your head. Okay, and wearing the appropriate footwear, wearing a helmet. Okay, and here's some more tips here, but know one thing about helmets, they don't actually completely prevent concussions. And we know this through sports. It's very important to wear a helmet and to properly fit it, but mostly they're really there for the physical trauma that's going to hit your head. But again, know that if you're wearing a helmet and you take a hit off the head, it doesn't mean that you don't have a concussion. Okay, so some steps to take if a worker has concussion symptoms. Right away, you need to alert a supervisor, and you need to report the incident immediately. And this is very important because you can have those delayed symptoms. So somebody might have a bad fall at work, and they feel fine throughout that day, but then the next day, they have all these concussion symptoms. So it's important to report any incident that might look like it could cause a concussion. Okay, you want to seek medical help and try not to diagnose yourself. And that's very important because if you do have a bad concussion, you're not in a really great place to be diagnosing yourself. Okay? You don't want to drive or be left alone. If somebody looks like they've had an event at work, you want to set up a way for them to get home for their commute safely. And one thing that I was involved with at Western was looking at nutrition and concussion recovery. And we found that it is very important to get people nutrition right away. Your brain is using so much energy in trying to repair itself and go through this injury. And a lot of the times people feel off and they feel like they might have nausea, so they don't want to eat anything. But it's very important to get them nutrition, even if it's juice or anything, right away. So there's a lot of risks if a worker returns too early. So even with good intentions, you might be unintentionally pushing the worker to activities that might be too demanding or stressful from a cognitive perspective. And that's very hard to predict, again, but you got to work back and forth with the worker and make sure they're not getting pushed too hard. Okay, they may be leaving very exhausted, and they may be forgetting things or doing things without their required mental capacity, which could be dangerous. Okay, there's a group, this is a study from the UK, who had sustained mild to moderate TBIs, and they reported on some of the issues that they faced when going back to work. And a big one that I talked about was the invisibility of their injury. They also talked about continuing symptoms affecting their ability to do their job. They had a lack of advice or guidance on returning to work. And in addition, their return to work support systems were considered to be poorly coordinated and managed. Okay, I won't go through these, but these are some factors that were associated with poor functional outcomes. Okay, there are limited treatments for concussions. And traditionally, and when I had my concussions, and it was 2010, I was told just to rest. Go and sit in the dark, don't come around the team, go hang out at home, don't watch TV, don't be on your phone, don't read. And you very much feel in the dark, and that causes some mental stress for sure. Okay, a lot of times it means being off work. Compared to other injuries, concussions definitely keep people off work more. There are ongoing treatment options that are being researched, but there's no best practice for those who do not experience spontaneous recovery. Okay, there are some general tips, things like not using alcohol, getting your proper rest, not taking any drugs, sleeping pills, sedatives, avoiding sports or anything that could cause another concussion, and getting back to your normal activities gradually. Okay, so for a worker, rehabilitation therapy may be key during recovery and may include speech therapy, occupational therapy, physical therapy, and a combination of the three. You might realize that the worker's thinking, speech, and reaction times might be slowed, and they may be less able to concentrate. They probably won't be as productive as usual at first, and their job tasks may need to be altered. So again, it's gradual process and very key, gradual, safe, work back and forth with the worker, maybe put a physical job to a sedentary desk job, gradually increase the amount of hours that they work for the week, and be careful about symptoms that may come back. Okay, it's important to respect any work restrictions from a doctor. It's reduce the physical and cognitive exertion, reducing the work initial stages of healing may help the employee's recovery. Okay, you want to do things like reductions in sound. When I had my concussion and I came back, just being in the locker room and hearing stalls in the bathroom close was too much for me. And it's very important to work through all their symptoms and see how you can help them as best as possible. Okay, and again, ensure that they can get to work safely. And this is very important too, is be positive. And I've read a lot about this and some qualitative information about people going through concussions at work. And they talk about the fact that you're left alone, you're sent home, you're away, and if nobody reaches out to you, you can feel very isolated. So it's very important to be positive, be very reassuring to the person. The injured employee is in a very vulnerable state, and the symptoms that they might worsen, they get worried that symptoms might get worse, and it just leads to more anxiety and more problems. So you really want to reduce any stigma surrounding concussions in the workplace, and any, making anyone feel vulnerable. So talking about underreporting of concussion symptoms. So education is important, and it's really important to educate people, but still they will definitely underreport concussions for various reasons. Okay, again, because it's an invisible injury, you can show somebody your broken leg, but you cannot show them your concussion many times. So they feel pressured, that they can't show that. The assessment, it's not very simple. You're not just looking for pain, you're looking for these symptoms that are arising, and sometimes it's very hard to do that. Okay, in a survey among ED patients, 88.6% of the respondents who experienced concussion injuries reported that they didn't recognize that they had suffered a condition. So even though people do know a lot about concussions these days, they're still not attributing them to concussions. So it can be knowledge, it can be assumptions about how it will affect them. And this was a very big one that I found with the CFL players, is they thought that, a concussion for me means I have a headache. You know, I took a big hit this game, and now I don't have a headache, so I probably don't have a concussion. So you always got to know all the symptoms that are possible and be aware that any of those could mean a concussion, and not just, you know, there's no individualized concussions for you. Yeah, I'm just done. Your social identity can be a problem if you consider yourself a tough guy, a tough worker that's never going to take time off work for a little headache or something. They might underreport for that reason. Okay, they might have job security or a fear of job loss. If you're a self-employed worker, you might not have the financial means to take that time off work to properly heal. Okay. People also assess the event that caused the concussion. So I talked a little about this. If they didn't hit their head, they might not think that they have a concussion. They're very uncertain of the diagnosis. Again, how hard is it to tell if you're in a fog or not? They're also uncertain of the risk to continue. If you feel like you have a little headache, maybe you think, oh, I'm okay, I can work through this. But if you take that second impact, it could be very, very drastic. And about the drastic, symptoms are not drastic enough. And that was a big one when talking and looking through research, is that if it's not a terrible headache that blocks them from doing anything, they're just going to work through it. Okay, painkillers may be also masking symptoms. If somebody's taking Tylenol every day for their back, it could be masking some neck pain or some headache pain. There's also external pressures to work. Sometimes those are generated internally, thinking people expect me to be here, they expect me to work through this. Any upcoming deadlines or goals. Normalization about concussion symptoms is much bigger in sports. And then delayed symptoms. Okay, everybody, I think, should be helping with concussions, especially in the awareness and education. But definitely you want to start with doctors, nurses, physiotherapists, ergonomists can help out in the workplace, your joint health and safety committee. Now I know in high schools, teachers and coaches are expected to be knowledgeable with concussions in sports. But definitely increasing the awareness overall is going to help everyone. Okay, you can go through, these are some validated tools that are used to measure post-concussion syndrome. So there's a lot of these, and basically what they are is big lists to check through all the different symptoms that you might be having. So just a quick example of one. The Rivermead post-concussion symptom questionnaire, probably the most used one. As you can see, you can go through and check off how you feel compared to beforehand. Okay, I've provided a bunch of helpful links and resources, and these are all the ones that I could find to summarize everything and bring all this information together. So I will, again, be providing the PDF after, if you want to look through all those different links. Okay. Okay, thanks, and if you have any questions. Yep. So if you, so the question was, if you go through and you go to a doctor and the doctor doesn't see that you're showing these symptoms or doesn't think that you have a concussion, but you still feel these symptoms, what do you do? I would say that I would be very hopeful that the doctor wouldn't dismiss it, but if that happened, I would definitely seek a second opinion, because you know yourself inside what you're feeling, and if you feel off, there could for sure be something wrong. So it's very important I would get a second opinion on it. Yeah, there's many clinics now, and what's happening a lot of times is they're combining a bunch of different professions to help deal with concussions as a group, and so those are available now, and your doctors can send you to those as well. Yeah. So the question is potential blasts. How are they affecting? And then sorry, the first. Oh, between the long-term effects. Yeah, the frequency with the long-term effects, I haven't noticed that it's a very high frequency. It's more that they're showing that these things have been shown to lead to them. But definitely, with football players, they can only find out things like CTE once they're doing an autopsy. So they have shown a pretty high percent in the studies that they've done, like over 80%. So, but those were the ones that were cases that were donated to them. So it's kind of hard to know how many exactly. And things like Alzheimer's, again, there's a lot of other things that add into that. So if they have a history of depression and things like that. So it's very hard, but from what I've gathered, it doesn't seem like it's a very high percent that end up that way. In most cases, I would say over 90% of concussions definitely come out fine within a number of days to weeks. Oh, so and the blast effect, yeah. And I did actually read there's studies with RCMP and the military and bomb diffusers, and they're continuously getting blasts and dealing with that. And it's very similar to sport hits to the head. So that profession definitely needs anyone dealing with blasts like that. It's very similar to the effects of getting hit in the head. I would guess so, yeah. I just know that I've read that they've been studying with bomb diffusers, and they've had problems as well.
One more question, I think. Physical injury?
Yes, yeah. Yeah, and things, there's physiological issues that are going on in the brain. And it's something like CTE is actually a buildup of tau proteins that slowly generate and wrap around neurons in the brain and cause the cells to die. So it's definitely physical.
Thanks, Daryl.
Thanks.